Good day, and welcome to the course on climate change and human health in Montana. This module is specific to the health impacts of climate change, with an emphasis on those that will affect Montanans, but also looking at the global level as well. I'm Dr. Robert Byron, an internist who lives in Hardin, Montana, where, along with my wife, Dr. Lori Byron, a pediatrician, has practiced for over 30 years. Before going further, we'd like to acknowledge that we inhabit the unsurrendered lands of the Absaluka or Crow people who've been stewards of their land for thousands of years. We are indebted to both the Crow and Northern Cheyenne peoples for their openness and the trust that they have placed in us. In this module, we'll discuss the current and future health impacts of both air pollution and climate change likely to affect Montanans. We'll talk about actions that could lessen the impacts of climate change, both on Montanans and others. And particularly importantly, want everybody to be able to list barriers, political, economic, cultural, or others, that may hinder effective action on climate change, as well as suggest possible ways to overcome those. We'll start with the barriers. The reason to do that is so you can keep them in mind as we go through the presentation of ways that we can overcome these. Perhaps foremost is fear. The fear that there's nothing that we can do, which I hope to dispel many of your doubts in that regard during this presentation. Another is denial that climate change is happening, or complacency that it's something that we need to address now. Certainly, politicalization is a huge one, both in our country between Republicans, Democrats, conservatives, progressives, and at a more global level between the United States, China, Russia, European Union, suggesting that it's somebody else's fault or somebody else's problem to deal with. And lastly, and certainly not least, is money. Money is it to invest in the change that we need to happen, or money because certain people don't want to address it because it may impact their ability, or their profits. This shows that the Climate Change and Human Health Report that was released earlier this year. Much of the information from this presentation is obtained from that, and it provides both more detailed looks into the aspects of climate change that will affect human health, but also has a large number of recommendations, suggestions, and ways that we can take actions, both as individuals and within our communities. So let's start with what is climate change, or what are we talking about? This slide is taken from the 2018 Lancet Countdown U.S. Brief, and across the top shows climate pressures, so increasing temperatures, more extreme weather in terms of storms and others, rising sea levels, and extremes of precipitation, primarily rain, but that can also apply to snow. Across the middle of the slide are exposure pathways, ways that those climate pressures will start to impact humans. Extreme heat and heat waves, more air pollution, and we'll discuss that in more detail. Water contamination, changes in vectors such as mosquitoes, fleas, and ticks, increasing allergens. Particularly importantly, both food supply and food quality, and population displacement. And then there's the health outcomes and ways it affects individuals. Certainly heat stroke and heat exhaustion, more respiratory and cardiovascular disease in forms of more asthma, flare-ups of lung disease, more strokes and heart attacks, gastrointestinal diseases, vector-borne diseases such as Lyme, Zika, or West Nile virus infections. One often overlooked and understated are mental health effects of climate change and the many impacts there, which we'll discuss. Particularly important are the impacts on pregnant women and their fetuses. And then the physical trauma. This includes both those from storms like hurricanes, but also injuries to people from wildfires, which we will talk about in a little bit of detail. Ultimately, climate change will be an equal opportunity disaster. But certain populations and groups of people are more at risk. That includes the elderly and the very young, pregnant women and their fetuses, indigenous populations, people with low incomes, people with chronic medical conditions, including mental health disease, outdoor workers, and rural populations. When CDC looked at the counties in the United States most vulnerable to disaster from climate change, they found that of the 10 counties rated most vulnerable, 81% of those are people of color, which is another very high-risk group. So let's shift track a little bit and talk about both air pollution and climate change, and try to put those in a little perspective. Currently, we are putting about 162 million of air pollutants into the atmosphere every 24 hours. Now, let's separate those out a little bit. And this is a fairly simplistic way that I like to look at it. So climate change is caused mostly by greenhouse gases. Those are air pollutants, but we'll talk about that separately. But that includes primarily carbon dioxide, just from the sheer volume that we put into the air, methane, nitrous oxide, and fluorinated gases primarily. The aspects of air pollution that have the greatest health impacts are different. They're also air pollutants, though. That is particulate matter and ground level ozone being the two most important. I've listed allergens here because those also has significant impacts, and we'll talk about those later. The air quality across the United States in general is much better now than it was several decades ago. And that's primarily due to the Clean Air Act and the efforts of organizations like the American Lung Association and others to have that act enforced. Despite that, however, there are still anywhere from 68,000 to 250,000 deaths every year in the United States from air pollution. One estimate from last year in the fires in California during the months of August and early September, there were 3,000 excess deaths just from wildfire smoke. For some perspective, it's also worth pointing out that despite the improved air quality, it has had little impact on decreasing the onset of climate change. We have to do more. So let's talk about particulate matter. What is it? I used to think of particulate matter as just dust and other benign things that made us cough but didn't cause other problems. And I couldn't have been further from the truth. Particulate matter does include dust, but it also includes heavy metals, acids, volatile organic compounds, and others. We differentiate particulate matter by the size. For example, PM10 is about 10 microns in size, PM2.5 is 2.5 microns in size, and ultrafine particulates are less than that. This image shows some different things that we might have an idea about in their size. The long brown thing that looks like a sandworm from Dune is a human hair, which is about 100 microns in diameter. A single crystal of table salt is about 70 microns in diameter, and it also shows pollen and mold. At the top is a particle of about 10 microns, PM10, and PM2.5. Well, let's look a little further. This takes it down even smaller. On the right is a particle of PM10. Next to it is a human red blood cell, which is about 6 to 8 microns across. And then next over is a particle of PM2.5, just for some perspective. Now, these photos make it look like they're just inert particles, and that's not actually the case. As I mentioned, ozone and particulate matter, particularly PM2.5, are two of the primary causes of health impacts from air pollution. Ozone forms both in the higher aspects of our atmosphere, where it protects us from stronger ultraviolet rays, and this is the ozone that we've heard about that has holes in it over the Arctic and Antarctic. But more importantly is ground level ozone. It's at the level that we breathe. And it's caused by the effects of sunlight on air pollutants, specifically nitrous oxides and VOCs, or volatile organic compounds. As temperatures go up, everything else being the same, more ground level ozone forms. Between ground level ozone and PM2.5, these enter the body and set up their inflammation. They're very biologically active. As a result, we see accelerated atherosclerosis and vascular disease with increased heart attacks and strokes. These can have negative impacts on both fetal and maternal health, with preterm labor and low birth weight. It also has impacts directly on the lungs, which is where they enter the body, with both short and long-term impacts. It's worth noting that PM2.5 particles have been found on the fetal side of the placenta and also in our brains on the other side of the blood-brain barrier. Now think about that. Particles that were breathed in getting into areas of the body that nothing should be reaching. Moving on, we talked about allergens, and the reason to mention those is in one study it was estimated that the grains of pollen per cubic meter in an area were about 8,000 grains per cubic meter in the year 2000. By 2040, that will increase to about 21,000. Now, allergens are more than just an inconvenience for people who have hay fever. These can cause life-threatening flare-ups of asthma for people who have underlying lung disease. Well, having talked about it, is there anything that we can do to make a difference? Absolutely. In 2011, I-405 in Los Angeles was going to be shut down for about 36 hours for repairs. That resulted in a drop of about 60 to 70% of traffic within the area. And what happened was that the air quality improved for a radius of 100 miles within minutes. Ultrafine particulates were down 83%, PM2.5 about 36%, and what they saw locally was that emergency room visits at UCLA, which is located in the area, were down 23%, Mount Sinai ER visits 13%, and 911 calls decreased by 12%. Another good example, in 1996, the Summer Olympics were held in Atlanta. When traffic was reduced 20%, emissions dropped 30%, and pediatric asthma admissions dropped 40%. We've also seen pictures during the COVID pandemic of vistas and mountains that had been blocked by air pollution all of a sudden being clear. All of these are important, and it shows how rapidly our air quality can respond if we make needed changes. Now, it's also worth pointing out that none of these changes are enough to affect climate change, because the same thing has to be sustained over a long period of time, not just a few days or a few weeks. Let's look at some of the heat impacts of climate change. First, heat is the leading weather-related killer in the United States. Direct impacts are things you might consider: heat exhaustion or heat stroke, or dehydration. But we also see indirect impacts: more heart attacks, more strokes, increased numbers of suicides, increased lung diseases or respiratory illnesses. There's even been a relationship to increased diabetes. And our thinking or cognition gets worse as temperatures get warmer. Other associated heat-related impacts, as we talked about allergens before, because of longer seasons and enhanced growth. Plants like ragweed like the higher CO2 levels and the warmer temperatures. We also see more harmful algal blooms, which affect both recreation in waters, but also can be dangerous to humans and pets as well as livestock. Let us not forget the impacts of drought, with both agricultural losses and stress, and also increased fungus exposures from being raised with increased dust and drying. Wildfires are something we deal with in Montana and throughout the West on a regular basis. But I think everybody understands that they are becoming much worse, more intense, and burning larger areas. There are several factors in that. One of them has nothing to do with climate, but is the long-standing forest management practices of fire suppression. But climate is a major contributor to wildfires, or worsening wildfires. With earlier snowmelt, there's less moisture later in the summer. With warmer temperatures, there's increased transpiration from plants and decreased soil moisture. There's also increased lightning strikes with warmer temperatures. Now, having said that, most wildfires are still human-caused, but we might anticipate more problems with wildfires from lightning in the future. And also, there's less winter kill of pests, again, damaging the forests. And just to point out of interest, for every degree centigrade of warming, one study showed lightning strikes increased by 10 to 12%. In Montana, our annual fire season is about 78 days longer than it was in the 1970s. And obviously, wildfire exposes us to more smoke with particulate matter and other air pollutants, as well as puts people at risk for loss of property, as well as the people fighting fires and other first responders. Changing to food and waterborne diseases, these become worse with climate change. It's worth noting that diarrhea is the number 2 cause of death in children under 5 years of age globally, with over 1.5 million deaths per year. It's also a major cause of malnutrition. Also, worldwide, about over 1 billion people lack access to safe drinking water, and 2.5 billion lack improved sanitation. What happens with flooding from extreme precipitation events or earlier snowmelt is we see overwhelming of water and sewer treatment facilities in developed areas and contamination of water in many areas. Studies in India, Peru, and China found a 1 degree Celsius rise in temperature resulted in a 5 to 16% increase in diarrheal illnesses. Now think about that in perspective to what I mentioned earlier about diarrhea being the number 2 cause of death in small children. In the United States, waterborne disease outbreaks are positively correlated with excess precipitation. Also related to waterborne diseases are the impacts of ocean warming. Now, the oceans have absorbed a significant portion of the increased heat that we've seen created. That has resulted in conditions like more ciguatera fish poisoning or paralytic shellfish poisoning, which results from red algae. And particularly important is the spread of Vibrio, which is a bacterium that causes both skin infections and can cause overwhelming sepsis, especially in people with diabetes. Normally a pathogen of warming waters, we're seeing it spread. And this shows the coastal areas in the northeast United States suitable for Vibrio to live. It's also been reported in Alaska increasingly. Vector-borne diseases, again, are those that are spread by fleas, ticks, and especially mosquitoes. As temperatures warm, those vectors can spread. They can spread, call it poleward migration, spreading closer to the north and south poles, but they also can spread to higher elevations because of the warmer temperatures. Other situations that occur is that the pathogens, such as the malaria parasites that mosquitoes transmit, develop faster in the mosquitoes. The mosquitoes bite more, and they lay more eggs, all contributing to spread of diseases like malaria. In Montana, vector-borne diseases may not seem like too big a problem yet, and this shows a graph that in 2003 there were only a few cases of tick-borne illnesses. Now, this doesn't include things like West Nile virus. And by 2018, we still only had 15 or so that had started in the state, with a few others that had been acquired outside the state. So those numbers aren't too impressive. When we look at the U.S. as a whole, though, things change. This shows disease cases from infected mosquitoes, ticks, and fleas, starting in 2004 on the left at about 27,000 and increasing to over 96,000 in 2016. That's tripling in a little over 10 years. That's huge and ominous. Globally, we see spread of diseases like West Nile virus, chikungunya, Chagas, and dengue fever, among others, affecting wider areas. We haven't seen significant spread of most of those, with the exception of West Nile virus, which is spread significantly in the U.S. But the situation is such that it could happen. On the left is the range of Aedes aegypti mosquito in the United States in 2017, and on the right, Aedes albopictus, or the tiger mosquito. Both of these can transmit yellow fever, dengue, and Zika. And noting that they are present in increasing areas of the United States, the potential is there for greater spread of some of these diseases. Perhaps some of the most significant impact of climate change and air pollution are on pregnant women and their children. If something impacts those of us who are adults, it's bad, but we deal with it. But if it impacts a pregnant mother, or correction, a pregnant woman or her fetus, then that child will be affected their entire lives. So some of the ways that can happen is severe weather, lack of food or water, population migration or displacement, food contamination, and exposure to diseases. Now, talking about air pollution again, it's been associated with infertility, and also a nice study out of California showed that fertility rates increased after nearby oil and coal-fired power plants were closed, suggesting a direct correlation there. If a mother is exposed to dirty air, whether it's from industrial pollution, traffic, wildfires, the child or her child is at risk for preterm birth, sudden unexplained infant death, previously called SIDS, thyroid disease, and high blood pressures later in life. It also increases several other conditions, ADHD, schizophrenia, mood disorders, type 2 diabetes. IQs may be lowered. Heat alone, separate from air pollution, has been linked to premature births, intrauterine growth retardation, stillbirths, and birth defects. And IUGRs, or intrauterine growth retardations, important. It's not just children born with smaller organs. They are at higher risk for complications and medical conditions throughout their lives. This next slide shows it in more detail. It's a little busy, but it also has more references and citations on it, as does the next one, looking at neurodevelopment issues. Lastly, maternal stress caused by exposure to natural disasters or other adverse life events is associated with adverse pregnancy outcomes. In utero exposure to maternal stress from bereavement and other weather disasters such as Hurricane Katrina can also lead to preterm birth, low birth weight, metabolic derangements, and elevated BMI in children. One of the most important, but also perhaps most insidious impacts of climate change is on nutrition and food security. In the United States, before COVID, about 11% of Americans were food insecure. Now, food insecurity refers to the inability to consistently have access and afford adequate nutritional food. Food insecurity as a child can add to lifelong health and mental health issues. So it's not a benign condition. During COVID, food insecurity increased to as much as 40% in the United States. Over 3 million children a year globally die from hunger, about a third of pediatric deaths according to WHO. So this is a huge problem. How does climate change affect food security? Well, consider that worldwide, grains are the main sources of calories for most people. With warming temperatures, pests and pathogens are migrating towards the poles. They live longer, so there's less winter kill, and they propagate more and faster. Grain productivity decreases for every day over about 84 degrees Fahrenheit. With increased carbon dioxide levels, crops grow better, but are less nutritious. They have less protein and fewer micronutrients, particularly in the grains and soybeans, and make more carbohydrates. Now, for those of us, or most people in the United States or developed countries, where we have more than enough calories, that isn't a problem. But in people who have borderline nutrition or borderline malnutrition, then that can tip them over into full-blown malnutrition. In coastal areas, seeing more problems with saltwater intrusion. both in coastal lands and aquifers. And then many issues with drought worldwide, resulting in decreased productivity due to inadequate water. For 20% of the population, the oceans are their primary source of food. The oceans, as noted earlier, have absorbed significant amounts of heat, which has resulted in some changes. For example, coral reefs worldwide have declined about 50% over the past few decades. And coral reefs is where large segments of ocean fishes and ocean life start their lives. Also, the oceans have absorbed a large amount of the carbon dioxide put in the air, which has resulted in acidification. As ocean waters become more acid, shelled animals have an increased problem producing their shells, and this is particularly important for the zooplankton, which are at the bottom of the food chain. If those zooplankton start to fail, then it will have impacts all the way up the food chain. So what do we do? Well, there's a lot of things we can do. Particularly when you look at the agricultural sector, whereas now agriculture is a carbon source, with transition to sustainable and regenerative agriculture, our soils can both become more healthy and become a carbon sink to pull greenhouse gases out of the air, specifically carbon dioxide. In 1965, a group of women in Japan approached a local farm family with an idea to get fresh vegetables and fruits for their family. A contract was drawn up, and the TEKE concept was born, which is translated into the Community Supported Agriculture, or CSAs, that we see in the United States and other places. Translated, that literally means food with the farmer's face on it. This, the many thousands of farmers markets that are cropping up in the U.S. and elsewhere, result in people eating more healthy, making better selections on their food, and also benefit the farmers. Other things that we can do related to food and agriculture is, for example, ask our local grocers to get ugly fruit rather than throwing it away. Food waste is one of the most significant causes of greenhouse gases. So if we can address that, that could also have a huge impact. Another significant impact of climate change on our health is climate displacement. This is usually the result of extreme weather events, which outrightly result in about 60,000 deaths a year on average globally. But events like sea level rise, drought, floods, hurricanes can all result in climate displacement. In 2018, there were 1.2 million people in the United States displaced as a result of climate. Worldwide, it's more on the order of over 20 million a year. Now, some of these people can return to their homes at other times, but others can't. We've seen the direct result of similar issues where we live in Bighorn County. In 2011, we saw significant flooding, which resulted in closure of the Crow Northern Cheyenne Indian Health Service Hospital for a few days and caused people to move out of their homes. It fell out of favor in the news, and things opened back up after a while, but people were displaced from their homes and had to be put up with other family members or in FEMA trailers, and even years later, some people had not been able to return to their homes, or if they had, their homes were contaminated with mold, making it hard. This is a diagram of the displacement of people from Hurricane Katrina, which hit New Orleans in 2005. And just look how widespread people went, many of whom never returned back to home. In a different context, sea level rise has resulted in destruction of many Alaskan villages, with people needing to be relocated elsewhere. Another impact that we talked about needs to be highlighted are the adverse effects of mental health on the adverse effects of climate change on mental health. There are increases in domestic violence, suicide, depression, alcohol and substance abuse, all increase with higher temperatures. After severe weather events, we see PTSD, anxiety, and depression are common, especially in children. Some medications prescribed for people with mental health disorders interfere with heat regulation. And we talked about the issues of prenatal air pollution exposure and neurodevelopment. So again, can we make a difference? We can. This is what we want to see. Children and others being able to play outside, to become healthier without having to worry about air pollution or smoke from fires. The Lancet Commission on Climate Change, which is widely respected, in 2015 said the effects of climate change are being felt today, and future projections represent an unacceptably high and potentially catastrophic risk to human health. But they also underscored that tackling climate change could be the greatest global public health opportunity of the 21st century. So what can we do? Individual actions. One, we can talk to friends, family, and colleagues. Surveys conducted over the past 10 years are showing increasing numbers of Americans believe climate change is occurring and that's impacting us already, on the order of 70% of people. But when we ask how many of those people talk to their friends and colleagues about it, it drops off to maybe 20% of people. So just talking to others about it, making this a topic of discussion and something that we can agree on so we can figure out solutions to it, is where it starts. You can join an organization. If you're a healthcare professional, Montana Health Professionals for a Healthy Climate, Healthcare Without Harm, Medical Society Consortium, or others, the Alliance of Nurses for a Healthy Environment, and many others. If you like to write, letters to the editor and op-eds make a big difference. One of the biggest things we can do is let our elected officials know that we think it's important. Even if we don't have the answers, at least let them know we think this is an important issue that they need to deal with. And lastly, and certainly not just unique to climate change, but we need to vote in every election. And for an important issue like this, ask your candidate, or even for local offices, but certainly for state offices and Congress and for the president, what's your plan to deal with climate change? We need to do something. It helps us feel better, and also it helps engage others so we can make this a topic of normal conversation rather than contention. And notably, if we do something, it helps us feel better even if we don't win. In focusing on the healthcare impacts, I want to highlight some testimony that Dr. Drew Shindell gave before the House Oversight and Reform Committee last August. He said that over the next 50 years, keeping to the 2-degree Senate pathway would prevent about 4.5 million premature deaths and 3.5 million hospitalizations in the United States. roughly 1.4 million lives could be saved from improved air quality during the next 20 years. A rapid shift to a 2-degree centigrade pathway could reduce the toll of air pollution, which leads to about 250,000 premature deaths per year, by just 40% in 1 decade. Now, all of those changes to improve our air quality will also help address climate change. Some of the most effective actions and their costs are noted by an organization called Drawdown and can be found at drawdown.org. They analyze the impacts of different actions and both the cost to implement and the cost benefits of them over the long term. Have a look at it. High up on their list was decreasing food waste. Another one is refrigerant management, because Freon and other refrigerants are such potent greenhouse gases. Move to renewable energy. We have got to stop burning fossil fuels. Increases in active transportation like biking and walking makes a big difference. People feel better, they are healthy, it improves the air quality, and can help the climate. Planting and reforestation. Certainly at the global scale, restoring our forest to health can make a big difference. On a local scale, planting trees, say in a city setting, helps people feel better, they are healthier, and they're more active. And also one which you may not think, but empowering, educating women in family planning were number roughly 5 and 6 as far as the most important things that could happen on a global scale. For the healthcare professionals, join in an organization like the Medical Society Consortium on Climate and Health, which has brought together over 600,000 physicians in the United States to amplify our voice on climate change action. I've listed additional resources, especially for healthcare professionals, and encourage people to reach out to either myself or my wife, Lori, who's listed here, or to join Montana Health Professionals for Healthy Climate. Climate change is the world's greatest group participation project. We either win together or no one does. Thank you.